The activity of each of the next generation ALK inhibitors was assessed in patients who have previously been treated with crizotinib and their disease has relapsed. In the studies that determined the activity of these drugs, ALK mutation testing was not performed. And so they demonstrated activity irrespective of such testing. As patients progressed on the next generation ALK inhibitors, it appears that one of the major mechanisms of resistance is development of ALK mutations or ALK amplifications. And this tends to occur based on available data in about 50% of the patients. Whereas ALK mutations as resistance or ALK amplification as resistance following crizotinib appears to occur in about a third of the patients. So as we use more and more of the next generation ALK inhibitors such as alectinib and ceritinib, both in the second line setting as well as in the front line setting, it is expected that a major mechanism of resistance will be ALK mutations. There are drugs available that can target these mutations and thus provide clinical benefit, and one such drug is lorlatinib that has activity against a broad spectrum of ALK mutations. And so what is expected as we use more and more of these next generation ALK inhibitors is that we would profile the patient's tumors to define the mechanism of resistance. If the patient's tumor has ALK mutations or ALK amplification, then we are much more likely to treat the patient with another ALK inhibitor such as lorlatinib, because it is expected that those are the patients that will derive benefit from another ALK inhibitor such as lorlatinib. Whereas in patients whose tumors don't have ALK mutation or ALK amplification as the mechanism of resistance, those patients may not benefit from another ALK inhibitor such as lorlatinib, and we might choose another treatment regimen such as chemotherapy. And so I believe that even though right now, as standard of practice, following crizotinib, disease progression following crizotinib, we are not routinely doing ALK mutation testing. As we use next generation ALK inhibitors, we will start doing more and more of the ALK mutation testing, because that is more of a common mechanism of resistance in following those drugs as compared to crizotinib. Now coming to liquid biopsies. In liquid biopsies, it is somewhat challenging to assess ALK translocations or ALK amplifications. But assessing ALK mutations is relatively easy in liquid biopsies. Liquid biopsies is clearly a much more easy way of defining the molecular features of a tumor rather than actually performing a tumor biopsy. And so it's quite possible that in the future, following progression of disease with one of these next generation ALK inhibitors, that we would do liquid biopsies and attempt to define the mechanism of resistance, and that might be used to determine what the next treatment is. As is the case in EGFR mutation positive patients, it is important to note that if a specific mechanism of resistance is not identified in liquid biopsy, that a tumor biopsy may still be required. So I do believe liquid biopsies will play a role in the future as we do more and more assessment of molecular mechanisms of resistance in the tumor. But at the present time, we really are moving from crizotinib to a next generation ALK inhibitor without defining the mechanism of resistance.